Serious health problems in seniors often begin with signs so small, most people never notice them until it's too late. Adults over 75 often believe feeling weaker, slower, or more forgetful is simply part of getting older. And while aging naturally changes the body, certain symptoms should never be ignored. Doctors often say early warning signs can appear quietly during normal daily life. A small change in energy balance, memory, or appetite may sometimes be the body's way of signaling that something needs attention. The good news is that recognizing these signs early may help seniors stay healthier, safer, and more independent for longer. Point 1. Loss of balance is one of the most commonly ignored warning signs. After 75, small moments of dizziness, stumbling, or feeling unsteady while walking may seem harmless at first, but repeated balance problems should never be dismissed. Doctors explain that balance changes can sometimes be linked to muscle weakness, inner ear problems, medication side effects, low blood pressure, vision decline, or nerve-related conditions. In older adults, even a minor fall can lead to serious injury and a long recovery. That's why sudden or repeated balance issues deserve attention early, especially when daily movement starts feeling less stable than before. Point 2. Clothes suddenly feeling looser can be another warning sign that should not be ignored. After 75, physical changes that happen slowly are often easy to overlook, but doctors say unexpected body changes may sometimes point to underlying health problems, reduced appetite, digestive issues, medication side effects, depression, thyroid conditions, or poor nutrition may all contribute to this kind of change in seniors. Over time, losing too much body strength can reduce energy and muscle function, making everyday activities harder and increasing the risk of weakness or falls. Even small physical changes deserve attention when they continue over several weeks or months. Point 3. Constant tiredness that does not improve with rest should never be ignored. Feeling exhausted after simple daily activities may sometimes be linked to anemia, dehydration, poor sleep, infections, medication reactions, or heart-related conditions. Many seniors slowly adjust to lower energy levels without realizing how much their body has changed. Doctors say ongoing fatigue becomes more concerning when normal tasks suddenly feel harder than before, especially when the tiredness continues every day. Point 4. Changes in memory can happen naturally with aging, but sudden confusion is not considered normal. Forgetting small things occasionally may happen to anyone, but getting lost in familiar places, struggling to follow conversations, or forgetting important routines may need medical attention. Doctors explain that dehydration, infections, sleep problems, medication interactions, or cognitive conditions can all affect memory and thinking in older adults. Early evaluation may help identify possible causes before symptoms become more severe. Point 5. Shortness of breath during light activity can sometimes be an important warning sign. If walking short distances, climbing stairs, or doing normal chores suddenly feels harder than before, the body may be signaling a problem involving the heart, lungs, or overall physical condition. Many seniors reduce activity slowly over time without realizing their breathing capacity has changed. Doctors recommend paying attention when breathing problems begin interfering with normal daily movement. Point 6. Hearing changes are often ignored because they happen gradually. Turning the television volume higher, struggling to hear conversations clearly, or frequently asking people to repeat themselves may seem minor at first. However, untreated hearing loss may increase isolation, communication difficulties, stress, and mental strain in older adults. Doctors often encourage seniors to check hearing changes early instead of waiting years before seeking help. Point 7. Difficulty standing up from a chair may reveal more than simple weakness. Doctors explain that changes in leg strength and mobility can increase the risk of falls and loss of independence over time. When walking, climbing stairs, or standing becomes noticeably harder, it may signal declining muscle strength, joint problems, or reduced physical conditioning. Regular movement, balanced nutrition, and medical guidance may help seniors maintain mobility longer. Point 8. Changes in mood or personality should never be overlooked. In older adults, pulling away from social activities, becoming unusually quiet, losing motivation, or feeling sad for long periods may sometimes be linked to loneliness, depression, medication effects, sleep problems, or underlying health conditions. Mental health remains extremely important after 75. Doctors say emotional changes deserve attention, just as much as physical symptoms do. Point 9. Swelling in the feet or ankles may sometimes be connected to circulation. Kidney or heart-related problems. Persistent swelling deserves medical attention, especially when it appears suddenly or becomes worse over time. Point 10. Sleep problems that continue every night can affect memory, mood, energy, and overall health. Poor sleep should not automatically be dismissed as a normal part of aging. Point 11. Loss of appetite can slowly reduce strength and energy. In older adults, even mild dehydration or poor nutrition may become more serious after 75. Point 12. Bruising, more easily than before, may sometimes be related to aging, skin medications, or circulation changes. Doctors recommend paying attention when bruises appear, more often without clear causes. Point 13. Changes in bathroom habits, including frequent urination or waking up many times at night, should not be ignored when they become persistent. Point 14. Pain, lasting for weeks, deserves proper medical attention. Many seniors delay discussing pain until it begins interfering with daily life. Point 15. Avoiding regular medical checkups may increase the chance of missing important early warning signs. Doctors often say many health conditions become easier to manage when discovered early. Point 16. Changes in vision should never be ignored after 75. Blurred vision, difficulty reading, trouble seeing at night, or suddenly becoming more sensitive to light may sometimes be linked to eye conditions that become more common with aging. Doctors explain that vision problems can also increase the risk of falls, driving accidents, and loss of independence in older adults. Regular eye examinations may help detect certain problems earlier, before vision becomes significantly worse. Point 17. Skin, wounds or bruises that heal very slowly can sometimes signal underlying health concerns. Small cuts that take weeks to improve may be connected to circulation problems, diabetes, poor nutrition, medication effects, or weakened immune function. Many seniors overlook slow healing because the change happens gradually over time. Doctors recommend paying attention when wounds repeatedly heal slower than they used to, especially when swelling, redness, or discomfort continues. Point 18. Sudden loss of interest in normal daily activities may be another important warning sign. When a senior stops enjoying hobbies, avoids conversations, stays in bed longer than usual, or loses motivation to complete simple routines, it may sometimes reflect emotional, cognitive, or physical health changes. Doctors say emotional withdrawal is not always a normal part of aging. In some cases, it may be linked to depression, loneliness, chronic pain, sleep problems, medication effects, or other medical conditions that deserve attention. Small warning signs are easy to ignore, but noticing them early may make a bigger difference than most people realize.